Abdominal wall reconstruction involves reconstructing the continuity of the muscular layer of the abdominal wall. So in general, the layers of the abdominal wall are the skin layer, the underlying subcutaneous fat layer, and then we have the muscle layer, and then behind the muscle layer are all the intra-abdominal organs. When people develop hernias and have problems with their abdominal wall, it is generally a problem with the muscle layer of the abdominal wall. What abdominal wall reconstruction does is it uses various techniques to restore the muscular continuity of your abdominal wall. And the technique or combination of techniques used depends on your hernia and the problems associated with your abdominal wall, as well as the previous or prior operations that have been performed. But the ultimate goal is to restore the muscular continuity or the muscular layer of your abdominal wall. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.